We now go to our reporter Laura Windsor to learn about a technology that is changing modern dentistry.
The future of dentistry is here, and it's called Waterlase Technology, developed by Biolase. It offers no cuts, sutures, or fear. We learned from Dr. Ramyar Elyassian, an award-winning diplomat of the American Board of Periodontalogy, about this new method of painless dentistry.
Waterlase technology has been used in medicine and in dentistry. With laser dentistry, the procedures were minimally invasive. But by that, I mean you really need to anesthetize less, or in a lot of the cases that I don't even use needles to numb the patient. We do surgeries with just topical anesthetic. And there's no other technology out there that you could do this with. One of the effects of laser when we do surgery is that it kills the bacteria. So not only you're making an incision, at the same time sealing the blood vessel so there's very minimal bleeding, you're actually sealing the nerve endings, which means less pain. The time frame where patients heal becomes half of what you do when you do this in a traditional way. When it comes to cavity preparation in a general dental office, you're removing only the decay and diseased tooth structure and not anymore. When it comes to cutting into bone or tooth, in a tooth, you could actually cause microfractures when you use the drill, versus in laser, you're only removing or erasing that disease site. What Waterlase has done, it has opened up a whole new door to a whole new treatment. It cuts both soft tissue and hard tissue. So I could actually cut both gum and bone with this laser. I use laser specifically as a periodontist in gum surgeries, where in the past we used to open the area, clean all the infection, and put everything back using suture. Now I could just use the same thing without using sutures, without really opening the gum, conservatively going around the gum and just treating the gum disease. Waterlase could be used in implant surgery to make the incisions, and when we actually do the second stage of implant surgery, we could actually do the uncovery before the crown is put on it. And that part of it could be done with without local anesthetic, with just topical anesthesia. Something else that I've found laser to be useful, and I don't think there's any other technology out there that could do the same thing as Waterlase, is that you could rescue failing implants. Waterlase, not only it detoxifies, it kills the bacteria, so we could actually go back and build bone in the area, saving an implant rather than removing it and starting all over again. Patients are truly amazed. I've had patients that came in, walked through the door, started crying just because they had this bad experience, having this done previously the traditional way. And they requested sedation, they requested some sort of pills to just calm them down, and we actually ended up doing the surgery with no sedation, under local anesthetic. They were actually making jokes during the surgery with me. This is really the new technology that's coming out, that it's a new generation, and it's really has changed and will change dentistry.